All right, here we go. So, ready? Following me? You see the salt? Okay, watch. Low salt. Perfect salt. High salt. Low concentration. Perfect concentration. High concentration. Hypotonic. Isotonic. Hypertonic. Hypotonic. Isotonic. Hypertonic. Low salt, low concentration, hypotonic. Perfect salt, perfect concentration, isotonic. This one, the big one, the lots of salt, high concentration, hypertonic. Ready? Half normal saline. Normal saline. 1% or 2% normal saline. Do you see it?
Yeah.
Mm-hmm. Half normal saline. What is normal saline concentration?
0.9.
So what is half normal? 0.45% normal saline. 0.9% normal saline. 1% normal saline, or 2% or 3%. High salt level. Got it?
Yeah.
Half normal saline, low salt, low concentration, hypotonic. All the same thing. Does that make sense to you?
Yes.
Perfect amount of salt. Normal saline, so 0.9%. 0.9% isotonic. Isotonic. Lots of salt. High concentration. Hypertonic. What's the other word I was saying?
1%, 2%.
1%, 2%, 3% saline. Pretty easy, right? There you go. There's fluids. Half normal, 1%, 2%, 3%. Now, stay with me. See this? This is a sugar pack, right? Watch. Throw it on there. D5, half normal saline. Boom. That's it. Watch. D5, normal saline. D5, 1% saline. Oh. Are they talking already?
They're about to start.
At 2. They haven't handed out the cards yet, just yet. Does that make sense? D5, half normal. D5, normal saline. D5, 1%, 2%, 3%. Got it? So is that hard? So what's this called?
Hypotonic.
Low content. Okay, no sugar on it. What's it called? Okay, and what type of fluid?
Half normal saline.
Throw sugar on it.
D5 saline. Half normal.
That's it. What's this called?
Normal saline.
Isotonic. And what's the concentration?
0.9.
What if I put sugar?
D5 saline.
Perfect. What's that called without sugar?
Hypertonic.
Hypertonic.
High concentration. 2%, 3%.
Throw sugar on it.
D5. Or 1%. 1, 2, or 3%.
That's it.
And it's
D5, 1%, 2%, or 3% normal saline. Not hard at all, right?
no.
That's fluids. It's based upon the concentration of salt. How much salt's in the bag? That's it. And then we throw sugar on it, we call it D5. So you wouldn't want to give a diabetic with uncontrolled blood sugar D5. Now watch, I want to show you one more thing. Okay, so see this salt? Watch.
Banana bag.
Sodium, phosphorus, potassium, magnesium, lactated ringers. Lactated ringers. Lactated ringers is electrolytes in a bag of salt, water. It's vitamins in a bag. That's all that it is. Do what? Do I need to drop the mic?
What was it? Salt,
Sodium, phosphorus, potassium, electrolytes.
Yeah, big time. Got to be careful though, because you got potassium, magnesium, sodium, phosphorus. These are your major electrolytes. So you can switch over really fast and get in trouble. This is used for post-surgery. And we use salt and we add electrolytes. I can build these electrolytes how I want, by the way, based upon your lab work. I can tell the pharmacy, put 2 milliequivalents of potassium in there for me. I can tell them, give me a 1.5 calcium and throw in a liter bag. I can change that, okay? Unless the hospital buys specific bags, but then we can just take additives and squeeze into the bag. Lactated ringers. This is like liquid IV. Yes, the liquid IV packets that everyone, this is liquid IV. Okay, but the liquid IV, it has extra stuff in it like ginsengs and things like that. This is just straight electrolytes. This is a BMP, basic metabolic profile, right? All those electrolytes we can put in a lactated ringer. And I build the ring so you can see it. We call it the ring of fire. And the ring of fire. And so when you get the bag, the lettering is in red. And it's in red because we want nurses to know that don't keep that fluid on because they'll get in trouble quick. Right? This is people that are in severe hypovolemic shock. Then they get lactated ringers.
Like sepsis. Would be one of the ones used for sepsis or not?
Maybe kind of. It just depends. This is more like, for me, it's people that come in with motor vehicle accident and a leg's cut off. And I've got a big volume discrepancy. I'm going to throw some lactated ringers because I know they've lost a ton of blood, a ton of sodium, a ton of magnesium, a ton of potassium. I already know that. They don't have a leg. So I got to replace it so that the heart and the electrolytes fire the SA node to fire expecto patrono to the heart. See it? If I lose my positive and negative charges because of massive rapid blood loss, then I lose the ability to fire at my heart so that the heart pumps and the brain stays alive. But if I go in and I throw lactated ringers in there, I can start replacing those. I just can't keep it like this. Because once we get the closure of the arteries and the veins that's bleeding out, then we're going to start holding on to the blood inside our highways. Make sense? This I'll do for someone that is,
A GI bleed?
absolutely a GI bleed. Yeah, because I have rapid blood loss.
What about
Burns.
Burns.
Number one.
So it's just fluid resuscitation, right? You're just putting
Big.
it back in.
I'm putting back in what should be in there. So if it's a burn patient, better believe it's going to be this. Because now they've just sizzled through all their body and all their blood vessels are opening up. So all their highways, they're green, they're red, they're blue, they're just sopping wet because the fire or whatever it was has burned through all layers. We're down to bone. That means they've lost all fluid. Severe hypovolemic shock. Death imminent. Unless I quickly throw in Trendelenburg, stop the bleed, get some oxygen on, and give back these fluids. Does that make sense to you?
Do you start like at 100 or
It depends. If I've got someone that's missing a leg or they've been in shock, I'm going to put fluid in until I get the blood pressure up. And I won't stop. I'll just keep dumping until I can get the heart beating correctly. And at the same time, I'm still giving medications to increase the blood pressure, right? Anything I can to save their life. I'm giving mass transfusion of blood.
Is there something you would use also pressure bagging to get them in their pressure? or no?
Absolutely.
Okay.
I pressure them all up anywhere I can. This is like multiple pressure bags because we don't have any, this is last ditch effort. We're going to put you on top of your head. We're going to pressure bag you. We're gonna breathe for you, intubate you.
So you're monitoring, EKG with EKG for the
Yeah,
the
these
potassium,
guys, they're on
blood
24/7
pressure.
monitoring. I'm watching the mean arterial pressure. I'm watching everything about are they going into VTAC, right? Because I just said, like, slap me that hard over here, that this person's lost mass blood. So then what happens is when the blood comes in through the atria, because it's not getting enough, it starts to sputter. Does that make sense? There's not enough volume of blood, so it sputters and it starts to shake and quiver. Atrial fibrillation. It's the blood's hitting the sidewalls because it's like, man, there's not enough blood coming through. How am I going to get through that valve, right? So it comes in and it sputters. Boy, it's like when you're running out of gas. You know how your car sputters? Same thing. So we pour more gas in, then it gets all comfy again and we start cruising again. But that's how we get these arrhythmias, is blood comes in, they're like, I don't know what to do, there's not enough blood to get to the ventricle. So it's like, I don't know, just hit it off the side of the wall. And it starts to fibrillate, and then the heart arrhythmia, it looks just like that. It looks like fibrillation because it is.
So it's happening to the heart when there's like a tamponade.
That's a good one, but that's another conversation.
Okay.
But I love how you're thinking. Okay, so are we good on fluids? Do we understand that hypotonic, isotonic, hypertonic, it's all related to the salt concentration? And that a high hypertonic fluid is a high osmolality. A high osmolality, hyper salt equals high, middle, or low osmolality. You got it? So when the NCLEX says something about a high osmolality, you're going to know it's a hypertonic solution. High osmolality, higher the concentration, the higher the osmolality. Make sense? Feel like you got your fluids down okay?
More than a blood can teach.
Yeah.
Yeah. All right, that's good. So probably you can pause that now.
Pause or
Stop.